Hey, Dr. Mills, this is Aylor for his final. Thank you very much. So we got the patient down, face down on the table. He's not in the appropriate footwear, but we'll make do for today. Arms by his side, and we look and don't touch immediately first. So for probability 1, we're gonna look here, cup his feet inwards, and then put him into position 1. Once he's in position 1, we are going to move it into position 2. We see that his leg has lengthened on the right side relatively from position 1 to position 2, indicating a possibility 1. From here, we're going to immediately pressure test the medial collateral ligament and look again, checking to make sure that we see improvement. We do. From here, we're going to find the medial border of the talus, and we are going to adjust on a setting 2 superior up through the Achilles tendon. Superior, inferior, superior and lateral and posterior through the Achilles tendon. Setting 2, bam. Next, we're gonna find that medial border of the knee. All right, find the MCL in that joint space. From here, we're gonna be doing the same line of drive down towards the Achilles, bam. I'm gonna check for improvement. We see some improvement, great. Next, we have an AS ilium. So we're gonna pull down on that opposite of the PD side, pressure test downwards and medially, and we're gonna look for some improvement here. We see some improvement from that pressure test. Here, we're going to find the first sacral tubercle, move a 1/2 inch lateral from there, and do a anterior and inferior adjustment setting 4. Bang. From there, we find the PSIS, move 1 inch lateral to the iliac crest. Same thing, but this line of drive is going to be inferior and slightly medial. Bang. Next, we find the ischial tuberosity right there, and we do an anterior, inferior, bang. All of those are setting 3s, or setting 4s, sorry. Thank you. And then next we have the L4. So can I get you to put your left arm behind your back, please, and thank you? Great. From here, we look to see his feet. Position 1, the right leg is short. We're in position 2, and his lengthen. Indicating the right side, L4. We're gonna pressure, go ahead and put your arm back down. We're gonna pressure test the inferior articular process of that L4. And we're gonna pressure test it up. Great. From there, recheck the feet, see improvement. Awesome. For this adjustment, it's gonna be on that L4 inferior articular process, going straight anterior and superior. Bam. Next, we have the OPD T8 complication. So can I get you to put your hands above your head, please and thank you? Awesome. From here, we check position 1. The right leg is short, into position 2, where it stays short. That's going to be indicating on the OPD side. We're going to pressure test that T8, TVP, T7, T8, TVP, pressure test it upwards. We're going to recheck the feet, looking for improvement. We find improvement. On that T8, TVP, we're going to be adjusting medial and slightly anterior and slightly medial. Bam. And then on that contralateral rib side, find that rib, it's about a 1/2 inch off the TVP. This one's going to be a setting 3. Both of these are setting 3, and it's going to be line of drive inferior and slightly, or lateral and slightly inferior. Bam. You can put your arms down now, please and thank you. Next, can I get you to tuck your right elbow? Just tuck it for me, like that. Perfect, and you can let it go. And we're going to check position 1, where we have a right short leg. In position 2, the left leg is longer, which is indicating a medial subluxation of the scap. We're going to pressure test the medial border of the scapula laterally, and then we're going to come back and check for improvement. We see improvement. We're going to adjust on a setting 2, the medial scap at the 2/3 inferior border of the medial scap. We're going to be adjusting this straight laterally, bam. Next, we go up to his arm, find the deltoid tuberosity right there, and it's a straight superior adjustment, bam. Next, move his arm out to the side. Can I get you to move your thumb up and down for me like that? Perfect. From here, I can find his radial head is moving right there, and you can relax that now. And our adjustment's going to be straight anterior and inferior, bam. Next, we'll take this, put the hand on the side, find the lunate, and we're just doing a straight posterior, bam. All these on a setting 2. We'll come back, check the feet again, make sure improvement, we see improvement, great. From here, we're gonna do C1. Can I get you to tuck your chin into your chest, please, thank you, and relax. Great. We're gonna check the feet. Position 1, that right leg is short. Position 2, that right leg is lengthened, indicating an issue on the PD side. So we're gonna find that TVP of C1, and it's going to be a straight lateral adjustment. Bam. Setting 1, setting 2 for all your arms, setting 3 up here, setting 4, setting 4, setting 2. In case we missed any of that. The last one we have you do is can I get you to put your left arm behind your back again? Awesome. And we're going to check for that superior L4 spinous process. We put the feet together. Awesome. We get them into position 2 and slightly past 90, and we're going to see that that right leg is going to be a little bit longer this time. So that's going to be an indication you can put your arm down. That spinous process is going to be superiorly subluxated. We're going to give it an inferior pressure test on L4. Recheck the legs for improvement. We see improvement, and we're going to give one final last adjustment inferiorly on the SP of L4. Setting 4, bam. Thank you very much for your time. Have a great day.